Hello, everybody, and welcome back to the podcast. I'm sorry I've been a little bit MIA. I know I have been. I've been really busy. And so, one of the things that I've been doing is I'm starting up a supplement line. And that supplement line has been taking up a lot of my energy. I've been researching and we've been doing branding and all kinds of exciting things. Watch this space. It's very exciting what I'm putting together. They're going to be incredible products made for midlife women. I can't wait to tell you more. But that's where I've been. So I do apologize that I've been a little bit MIA with this podcast. But let's jump back into the swing of things and let's talk about progesterone, because progesterone intolerance, progesterone resistance is something that is spoken about a lot these days. And I really think that you have to understand that you're not destined to live a life without progesterone. And so if you've been struggling with progesterone, if you've been struggling to take progesterone and you just think that it's not for you, these are the episodes for you. I think that it's very important you listen to these because progesterone is more than just a hormone that you bring on board to alleviate symptoms. So yes, it does that, right? So when you bring on board progesterone when you're in perimenopause, it's the first hormone that declines in perimenopause. And so it's usually the first hormone that we bring on in perimenopause. And it helps with things like PMS, rage, irritability, insomnia, getting to sleep, particularly, anxiety, heavy flooding periods, tender breasts, cramping. These are the types of things that progesterone helps with when it comes to your symptoms. But please know that progesterone does more for us than just help with our symptoms. And this is really important to understand for those women who just think, I do not tolerate it. That's okay. I don't need it anyway. Maybe you don't have those symptoms. Well, progesterone is very beneficial for our brains. It's beneficial for our cardiovascular systems. It's also very beneficial for our bone health, which becomes so important in midlife and beyond when osteopenia, osteoporosis can ensue. So it really is a hormone that I encourage you to replace when the time is right. And how do you know when the time is right? Well, oftentimes you'll get those symptoms. You'll start to get more of these low progesterone symptoms. It could be headaches, like I said, all the other symptoms. I don't want to repeat them all, but those are the symptoms that you want to look for. And if you don't get those symptoms, you probably will get something brewing, whether it may be late 40s or early 50s. But you don't want to wait too long. Progesterone is absolutely on the decline in your 40s. There's no doubt about that. You've not got this incredible, robust progesterone in your mid to late 40s. So in your late 40s, for sure, it's time to bring on progesterone. But let's talk about why some ladies do feel awful on progesterone. And I really want to validate that this is a very real thing. Progesterone is the most reactive hormone. It's a real shame. It's the one that gives us clinicians the most trouble because it is the one that people react to the most. How do you react to progesterone? What are the symptoms of reacting to progesterone? Well, you could get groggy, right? You could get really groggy or feel hungover the next morning if you're taking oral progesterone. This is a very common symptom that some women get when they take oral progesterone. You could also start to feel very depressed. You could get a very low mood, and this can be insidious. And again, this is oral progesterone that causes these types of symptoms. So if you've been taking it for a while, but you think your mood's a little low, maybe it is progesterone. So grogginess, you can get low mood. You could also get bloated from progesterone. You can get backed up. You can get constipation from progesterone. You can also get like that hungover feeling that kind of goes hand in hand with the grogginess. These are the main ones. Progesterone can also exacerbate symptoms such as anxiety or more of those typical, what a lot of women know as estrogen dominant type symptoms, anxiety, breast tenderness. We're going to get into why that happens. But first, I want to talk about why you might get groggy or a low mood or that hungover feeling. This is from the oral progesterone. When you take oral progesterone, it has to go through the liver. And when it goes through the liver, it makes metabolites, the main one called allopregnanolone. Allopregnanolone sedates you. It makes you very calm, very sleepy, but it can also make you very groggy. So if you're taking oral progesterone and you feel these symptoms of grogginess, low mood, hungover sort of feeling, then oral progesterone is probably not for you. And that's okay because you can take it in other ways. You can take progesterone rectally, you can take it vaginally, you can take it topically. There is a well-known menopause doctor out there saying, actually, there's a few of them saying that topical progesterone doesn't work. They are absolutely incorrect. And if you want to learn about this, then what I'll do is I'll link to one of my friends and colleagues' YouTube channels, Jill Chmielewski, and she interviews Dr. Phyllis Bronson and Carol Peterson, and they talk all about why this is completely and utterly wrong when you understand the physiology of the body and how progesterone is absorbed. But I've seen clinically too, this topical progesterone, it absolutely 100% works. I've tried topical, it works. My clients have tried it, it works. My clients have seen success with topical progesterone from mad panic that they've come into my practice in severe panic and they've applied enough topical and they've gotten calm. I've seen it with women who have had tender breasts and they have rubbed that progesterone on their breasts and it's taken away the breast tenderness. I've done that myself as well. So topical progesterone works. That's the answer. If you cannot do oral because it's making you feel gross, then the answer is to do topical, or you could do vaginally or rectally. Okay, so those are the things to speak to your provider about. Now, if you're taking progesterone in any of those ways, but you're getting constipation, you're getting backed up, maybe you're getting fatigue or you're getting bloated, you may have a Candida overgrowth. Progesterone will feed that Candida overgrowth. So if that's the case, you're going to want to work with somebody such as myself who can look into that and help you with that. I have a particular client who I think she's had a mold issue since her childhood. She has sinus issues. She also has a lot of Candida symptoms, and she cannot take progesterone for the life of her. No matter how she tries it, she cannot take it. And I believe it's due to a Candida overgrowth that she's got. So we're working to do the right Candida testing and then get her on a protocol so we can eliminate that Candida so she can take this progesterone on board because she absolutely needs it. And, you know, she's somebody with endometriosis, a history of fibrocystic breasts. If that's you, you need progesterone, right? But it's so important because those two conditions are telling us that you've had long-standing progesterone deficiency for a long time. Things like ovarian cysts, fibroids, endometriosis, bad PMS, rage, irritability, tender sore breasts. These are signs that your progesterone's been low for a while and we need to get that progesterone on board. So if we need to clear out your gut, and this is something that I'm very good at doing because I am a certified microbiome analyst. So if you need help with your gut, I can help you with that. Head to the show notes, and in there you'll actually be able to find a way where you can book a consult with me or work with me. But you need to get that gut sorted. We need to clear out that Candida, get on top of the dysbiosis so you can bring that progesterone on board and not get backed up, bloated or fatigued from it. Now, so your gut health matters, the delivery route matters. The other thing that matters greatly when it comes to progesterone is the dose. And so the dose of progesterone is critically important. Far too many ladies are working with doctors who don't have a lot of knowledge in HRT. Something that's really important to understand that I don't think a lot of women understand is that doctors do not get trained on this in medical school. So the curriculum does not train them on HRT, does not train them on menopause or perimenopause. Tiny snippet of training. That's yet to change. It's going to take some time to change, but it's not changed. So these doctors who are able to write the scripts for you doesn't mean they know what they're doing. So you have to become your own best advocate. Listen to people like myself, like Carol Peterson, like Jill Chmielewski, like all the wonderful people I bring onto this podcast. And you need to advocate for yourself and what you know your body needs. And when it comes to starting at the lowest dose of progesterone, this can be very, very dangerous. This is particularly dangerous for women with PMDD. If you have PMDD, if you have severe PMS, and you bring on a small dose of progesterone, you can wildly exacerbate those symptoms. You can feel absolutely awful. And I have seen this happen in clients, and I've warned them. I have one client in particular who this happened to recently, and her doctor gave her a 75 milligram troche of progesterone. Just so you know, that is a minuscule amount. So 300 milligrams of progesterone is where I think most women, if not all women, should start. Some women might get away with 200, and it depends on the delivery route. I want to make that very clear. Oral and topical delivery, you're only going to absorb about 20%. Vaginal, you're going to absorb about 80%. You need less vaginally than you do orally or topically. But let's say you're doing it orally or topically, 300 milligrams is probably the starting dose. And Dr. Jerry Lynn Pryor, she is one of the pioneers in progesterone research, and this is really something she knows a lot about. And she talks about 300 milligrams being a physiological dose, but especially for you ladies with severe PMS or PMDD, I think if you start lower than 300, and this is not medical advice, do not take this as medical advice. I am not your doctor. I am not your practitioner. You need to take this information to your practitioner and speak to them. And I will put some resources in the show notes as well. I'll put some sources you can print out and give to your doctor to read, or send them through to your doctor to read, that talk to this. But you want to start at a way higher dose. Dr. Dr. Katarina Dalton, she was a pioneer in progesterone therapy way back when. I think it was the 50s or so. She started her ladies who had PMDD or severe PMS with 300 milligrams twice daily, sometimes 3 times daily. Okay, so what's going to happen if you take more than you need? You might get a little groggy, depending on how you take it. But if you've got PMDD or PMS, you're going to get calm. And it's because of this inverted U-shaped curve that happens with that allopregnanolone that I spoke about originally. So people with PMDD or PMS, they react very poorly to moderate amounts of allopregnanolone. It can make them feel very crazy. It can make them feel a lot of anxiety. It can even make them suicidal when you've just got the moderate amounts. That's why after ovulation, when the body makes moderate amounts, they can feel really, really bad. However, they don't respond poorly to very, very low amounts or very, very high amounts. So when you bring on really high amounts of progesterone, that's when they feel good. That's when they get the calming anti-anxiety benefits of that allopregnanolone. But if you just give a moderate amount, that's where you're in the danger territory, danger zone. And that's when you can exacerbate anxiety, panic, right? We don't want that. And that's what happened to my lady recently. Her doctor gave her a ridiculously small amount. 75 milligrams is nonsense. And she took it and she almost ended up in the ER because of what it did to her. If she had taken at least probably 4 times that, probably wouldn't have happened. 5 times that even. I've had ladies who have dosed themselves up to 800 milligrams of progesterone and they found that was their sweet spot. You've got to talk to your provider and figure out what works for you. But be very, very careful on these small doses of progesterone. They cause far too much harm than good. And like I said, the worst thing that can happen to you is if you're taking it orally, you could get groggy the next morning. Something that Carol Peterson said was that, her belief is that you really cannot get too much progesterone, because when you look at where the mother's serum levels go in the 3rd trimester of pregnancy, I think she said up to 300. I really should have had this in front of me. I used to have it on a little piece of paper because I like to tell my ladies this, but it gets very high in the 3rd level of in the 3rd trimester of pregnancy. So in Carol Peterson's words, you can't get too much progesterone from bringing on board exogenous progesterone. So keep that in mind. All right, so we've talked about delivery method, we've talked about dose, we've talked about gut dysbiosis, we've talked about Candida, talked about PMDD. The other thing is when it comes to heavy periods, this is a protocol from Dr. Jerry Lynn Pryor, which I see work time and time again. It's worked in my clients and they've come to me with really heavy periods and they've had subsequent anemia. They've dosed their progesterone at 300 milligrams every single day, not cyclically. And within 1 month, the period has lightened. And then it just continues to lighten. You can go back to cycling if you want to after the period's lightened or not. Depends on your unique situation. Have a conversation with your provider. But that is a protocol for heavy periods that almost never fails. So if you've got heavy periods, but you've been intolerant to progesterone, you might want to try some of the strategies I've spoken about in this episode so that you can get that 300 milligrams, maybe more, every single day, because it will work to lighten your periods almost every single time, even if you've got fibroids, even if you've got adenomyosis. And I see this a lot. Women are having very, very heavy periods and subsequently they're having anemia. That anemia is coming from the heavy periods. Instead of taking iron, which can cause a lot of dysbiosis in the gut. Iron can be dangerous when you take it orally. In general, iron can be dangerous. I've spoken about this before. I always, with my clients, like to look for the root cause and avoid iron supplements as much as humanly possible. And when it comes to heavy periods, the root cause of the iron deficiency is the heavy periods, and the fix is enough progesterone. Okay. So I hope that was helpful. Like I said, take this information to your prescriber. I am not a doctor. I'm not your doctor by any means. And so take this information to your prescriber. I'll put some resources in the show notes. If you want to work with me, I'll have some information in the show notes about how you can do that. You can book a 30-minute consult with me. We can have a conversation. I can give you advice on your case, best next steps. But other than that, I hope you found this helpful, and I will speak to you next time. Bye for now.
I am not a medical professional, and the information provided in this podcast is for informational and entertainment purposes only. I do not have access to your individual medical history or circumstances, so the content discussed here should not be considered as medical advice. Before making any changes to your diet, lifestyle, or considering the use of supplements, please consult with a qualified healthcare professional or your doctor to ensure it's safe and appropriate for your specific situation. Any decisions you make based on the content of this podcast are at your own discretion and risk. Thank you for tuning in.